New weight loss drugs are changing the way people approach health and wellness. But with so much buzz around these medications, many have questions about how they work and who they're for. Joining me now from Providence is Dr. Fawn Wolf and Dr. Zach Conroy. Thanks for being here.
Thank you so much.
Thanks for having us.
Yeah, thanks for coming. So, Dr. Conroy, we'll start with you. Tell us about the class of weight loss drugs and how they work.
So the one that I think most people are interested is this GLP-1 receptor agonist class. They were originally approved as diabetes medications about 20 years ago. And they all work basically the same way. They mimic a natural hormone that our gut produces called GLP-1. And that hormone has a number of different effects in the body. One thing that it does is it stimulates the pancreas to make additional insulin in response to food and elevated blood sugar, and this is why they're so effective at treating diabetes. They tend to slow how quickly things move through the digestive tract. And then they are also involved in the appetite signaling from the stomach to the brain, so people generally feel less hungry, they feel full faster, and this is where that weight loss effect comes from.
Got it. And I didn't know that they'd been around so long, but I know that you, Dr. Wolf, have been using them for years. So how do they help your patients?
Yeah, I think it does surprise people sometimes to learn that they've been around for 20 years because a lot of people do ask, are they safe? And that can be somewhat reassuring to hear that length of experience that we have with them. So we have been using them for close to 20 years. We saw in the original studies that they were quite effective at lowering blood sugar in patients with type 2 diabetes. And they lower A1C, which is that lab that we check that tells us the average sugar over the last 3 months. They're uniquely helpful at lowering blood sugar after meals, so that postprandial rise in blood sugar. And that was something that until this category of drugs, we really didn't have other medications that could do that specifically, other than mealtime insulin, which can get somewhat complex. So we've had a lot of good real-world experience showing that they're highly effective at improving blood sugars. But really where they've started to stand out, of course, is with the weight loss that we've seen. And so we've seen with the newer drugs and at the higher doses that we use, they can often match or sometimes even beat the weight loss we see with weight loss surgery, bariatric surgery. And it's really been interesting to see this conversation unfold. So we've known for a long time from metabolic research that people who struggle with their weight tend to make more of the hormones that tell them they're hungry, fewer of the hormones that tell them that they're full, but we really didn't have the language to know how to talk about that. And I've had so many patients come back and say, gosh, for the first time I'm eating and I'm halfway through the meal and I realize I'm full and I'm gonna stop eating, and they hadn't had that experience before. So I think to some degree they help level that playing field with our relationship with food. And this was long before that catchphrase of kind of food noise came about, but this is what we started hearing from our patients.
Okay, interesting. What about, are they one size fits all? Like, should everyone with diabetes and obesity be on these drugs?
No, I would say no. I know this drug category well. I like it. It makes sense how it works, but that is, very much an individual decision. As physicians, we just want to help our patients be healthy, lead active lives, and so that's always going to involve discussions on what we're eating, how much we're eating, how we're moving our bodies, and then whether or not you want to add on a drug to that, of course, is a personal decision to make with your physician.
Yeah, and then, Dr. Conroy, I know that we can order these drugs online. Anyone can do that, but should they be doing that? What about safety and efficacy there?
Yeah, that's a good question. I mean, the convenience of online is certainly nice, but I think it's important to remember that these are powerful prescription medications, and my biggest concern with the online space is where people are actually sourcing the drug molecule from, and also do they have medical supervision. I think there's a very big difference between people that are getting these medicines prescribed by a licensed healthcare professional that's going to be screening for appropriateness, side effects, helping with dose titration and the like, and following you through your whole journey. And getting the actual medication from an FDA-regulated pharmacy that's ensuring quality and purity, versus some of these spaces where people are getting this class of medicines through health spas, through unregulated compounding sources, overseas labs, where you can't really be sure of what product you're actually getting. I've got a lot of concerns about the purity, sterility for an injection, and then just safety of actually following through with a medication like this. So I think it's best to be done with a healthcare provider and getting it from a known source.
Oh, for sure. Well, if you would like more information or to have a conversation, with doctors about this, you can visit the Providence website. They have a section discussing nutrition, diabetes, and health education services. That QR code on your screen will take you right to it, or you can also call them at 503-215-6628. Lots of information. There's a lot more that we didn't get to, so I would definitely encourage people to give you a call or go to the website and learn more. So thank you so much for coming today.
Thank you.
Thanks.
Appreciate it.